Welcome to the PODdoctors. I'm Dr. Damien Dauphinee, and I'm here with my partner,
Dr. Hussain.
And we are going to jump ship from foot and ankle for a short period of time, tie it into foot and ankle here a little bit, but talk a little bit about COVID-19 because there have been obviously some serious trends that are worsening in the United States. I hate it when we lead the world in things like new deaths. That's clearly not where we want to be right now with this.
Yeah, you don't want to be
virus.
number one in deaths.
No, it's kind of like golf. You want low numbers. We don't want to be where we are, and unfortunately, we're in this position for a number of different reasons. But today, we wanted to just run through the numbers briefly, just to kind of capsulize it, but then also talk about some things that we've learned recently are a bottleneck to getting rapid testing in the hands of every single American, and multiple tests so that we can be testing ourselves at home. And we can talk a little bit about why that's not happening. One of the reasons why Dr. Hussain and I got into this is we're both fans of Joe Rogan, and Joe Rogan is a really smart guy and Spotify podcaster extraordinaire. He's clearly the number one podcaster in the world and has been doing this for a while. And he's become good friends with Lex Fridman, who is an MIT professor who's actually involved in artificial intelligence and involved in autonomous vehicles. And I love listening to both of these guys. Lex has some fantastic guests, some really, really interesting guests. And one of the guests that he had recently was Michael Mina, and this was a few weeks ago. And Dr. Michael Mina is an assistant professor of epidemiology and immunology at Harvard in the T.H. Chan School of Public Health, Center for Communicable Disease Dynamics, and he is an associate medical director of microbiology at Brigham and Women's Hospital at Harvard Medical School. Very smart guy. And he's been trying to champion the idea that we're missing the boat by putting all of our eggs in the COVID-19 vaccination bucket. And I think his main point is that rapid testing would allow us to find out who's infectious, isolate them for a period of time so that they don't infect another 130 people, which is the average number of people that are infected when someone is transmitting virus and doesn't know they have the disease. Which is why our numbers suck. And Dr. Hussain, we can talk a little about the numbers. So what do you got here for us?
Yeah, so general numbers as far as the U.S. goes compared to the other major nations is we're at 360 plus thousand as of yesterday.
Total deaths.
Total deaths.
Yeah.
We're talking about deaths because that's the strongest number. Number of cases, if we're able to take care of them, I'm not too stressed about, although it does has side effects and further implications. Deaths are kind of
that's kind of the end of the line.
Yeah, there's no reversing that.
Yeah, I mean you don't want to see this, and this is clearly 2,387 per day.
Yeah.
Yeah, I mean that's the scary number. And look at the rest of the world. I mean, India, Brazil, Russia. I mean, some of these countries were a little concerned about their reporting. Obviously, I think some of them have been underreporting deaths because they don't want the PR nightmare that it entails. I get that, but we're all in this together. This is a global pandemic. This is a global problem, and without data, we don't see the trends. And these trends are god awful. Clearly not what we want at this stage. Coming upwards of a year into this. So, and this is really scary. And it's not, you were bringing up offline, we were talking about rapid testing. Clearly we are doing more testing in the United States. And so that would show there are more cases, but the death rate is rapidly increasing again.
Yeah, we're at our third peak, if you've been taking into account the mild peak that we had back in August. But our third peak, we're seeing the numbers trend higher and higher. Thanksgiving caused us a bump. Christmas just passed is causing us a bump. Kids are home from school and colleges, and the numbers of cases and the number of deaths have progressively been increasing. We're seeing numbers close to 2,000 to 3,000 each day in the U.S. That's twice the number of 9/11 deaths. I mean, each day.
Yeah, that's absolutely insane. And one of the issues is, again, the lack of rapid testing. And I just heard a stat the other day that the city of New York has only distributed about a third of the vaccine.
Why is that?
It's clearly they don't have enough people being able to do the injections. They don't have enough manpower. It's absolutely obscene. And you and I were talking about this offline about why don't we have every single practitioner who has the capacity to do an injection doing these?
Yeah. So I actually had the office manager reach out online to the what's it called?
TDL.
Moderna and
okay.
Whatever the
Pfizer and Moderna.
Yeah, to reach out to them to see if we can't start giving people the injection here. We give injections all day. You know, we have lidocaine, Dexa, Kenalog, and we would give 1,000 injections a day. And this is another injection that we could easily give. And they're limiting it to specialty specifics, like primary care or infectious disease. They're not letting most other specialties.
Just absurd.
Yeah.
It's just absurd. To do an injection of any material, you have to be prepared to deal with the repercussions, and that would be an acute anaphylactic problem.
Yeah, the injection procedure part itself, I mean, a monkey could do it.
Yeah, it's dealing with the potential repercussions if they have a hypersensitivity.
Yeah.
Clearly, that's not common with this vaccine, and we have to worry about those exact same things every time we do lidocaine, which is an anesthetic. Anytime we do triamcinolone, which is a steroid. There's the potential that particular patient could be allergic to that medication, and we have to be prepared to deal with that. We are prepared to deal with that. We do, tens or 20s of these a day, every single day, 5 days a week.
As podiatrists, we're doing HPIs, we're doing full medical care management.
History and physicals.
Oh, yeah, sorry, history and physicals.
Yeah. And we're doing this work every single day, and to clearly exclude us as a specialty from providing a public health benefit is absurd. So scope of practice being what it is, this is absurd. This is a pandemic, a global pandemic, and you're literally cutting out an entire specialty who could be doing these vaccinations 5 days a week.
Yeah.
We could even do them on the weekends. I mean, this is such a big problem for my community. We would open up on the weekends and do them if we had to. But we don't, because we can't, which is absurd. So that's one issue. The other issue is, and Michael Mina discusses this with Lex Fridman. He's also written a piece that was in Time magazine, published November 17th. And back in November, he said that widespread and frequent rapid antigen testing, public health screening to suppress outbreaks is the best possible tool we have at our disposal today, and we're not using it. And one of the reasons that we're not using it is the companies that produce this strip, this tiny little rapid test strip, is cents. It's 10, 20 cents. Pennies on the dollar. But it's being considered a medical device, which has to go through the FDA, which is absurd. We have a global pandemic problem that if the CDC would get together with the administration, our presidential administration, whether it's Trump or Biden, neither one of them seems to be moving on this. Yeah. They could literally wave their wand and say, this is a public health device. We are in a global pandemic. The rules change temporarily. This is no longer a medical device. This is a public health device, and we need to push these through. And they could start producing millions of these a week, tens of millions of these a week. And we could have them in the hands of every American who could test themselves 2-3 days a week if we wanted to.
So they're treating it like a medical device, like a glucometer or like any type of take-home TENS units. I mean, lymphedema pumps.
When you're not involved, when you're not in a pandemic, that's fine. We should have that level of scrutiny on medical devices. But when it's a global pandemic, the rules have changed, and we don't seem to be willing to change the rules enough to save lives. It's absurd.
If you look at these rapid test things, they almost look like those litmus tests that you can do for like chemistry experiments.
It's like they look like pregnancy tests.
It's pregnancy tests. Exactly. That's a prime example.
Yeah.
You literally put a drop of blood on there, your activator agent, and you sit there and you wait for a line or no line to show up to see if it's positive or not.
There's one line that shows that the control has worked, and then you're waiting for that cross.
Yeah.
And if the cross hits and you got the second line, then you know you're positive.
And you're pregnant.
And if you don't, and you just see the one line, then you know the control worked, that the device was not deactivated somehow, and that the testing strip was adequate. But that's it. That's all it takes. And
So,
we could be testing each other, several days a week. You could test before you go to dinner and know that you're not going to infect an entire group of people in your restaurant.
in Dr. Mina's paper, he said that if the U.S. decided to do this, and on a mass scale, it would cost them $5 billion roughly, and they could give 20 test strips per household and 2, what's it called, the PCR testing,
right,
testing
as a backup.
strips. Yeah. So if you got tested positive,
on the rapid antigen.
On the rapid antigen, you could sit at home, relax, wait another 24 hours, test again, and if you got a second positive result, then go do your PCR testing by all means.
Right.
You know, when you get tested positive, you have loved ones in the house or loved ones that that you're going to go visit. Stay at home.
Yeah, you just contact trace everybody you've come in contact with, and then everybody knows, okay, this person's been isolated, and they're not going to continue to infect people.
It's a silly thing. I mean, this is something that could easily be pushed out. This is like glucometers, except without an electronic device. I mean,
and this is another quote from Dr. Mina's piece in Time magazine, where he says the U.S. government can produce and pay for a full nationwide rapid antigen testing program at a minute fraction, literally 0.05% to 0.2% of the cost that the virus is wreaking on our economy now. So
of course,
just another way of continuing to allow the economy to open, to allow people to be out there, but isolate those folks that are symptomless, asymptomatic, and are potentially infectious. And that's not that difficult to do with a simple rapid test that's pennies on the dollar. The fact that we don't have access to this is insane.
Yeah.
We have multiple companies that can produce this, Abbott being one of them. Abbott has a fantastic version of this. And I think access to it has been hindered by this FDA approval process, which shouldn't even be on the table any longer, because this is a public health emergency. This is a public health problem.
If you take the social aspect of this, someone who gets exposed finds out that, oh no, I got exposed to a cousin or a friend who tested positive for COVID. Now they have to quarantine themselves for 14 days. And you're sitting there, you're like, I'm not having symptoms, I'm fine, I don't have to do anything, I'm going to go back to work.
Yeah, you could rapid test, find out you're negative, and go back to work.
Yeah, that's the plus.
Yeah.
But people are going back to work, and if they're a carrier, they're like, oh, I'm not symptomatic, I have no cough, no fever, but they're actually spreading it when they go back to work, and then their coworkers get it. We know multiple practices that have gotten sweeped because of this COVID. One of our nurses just recently got
one of
COVID,
our MAs,
and then we had to go get
we had to all get tested
over again.
It basically shut the practice down for a day.
Yeah.
Could have been longer. Thankfully, we all tested negative, but what a nightmare. If we all had the rapid tests in our hands, we could have done it that afternoon instead of basically begging any of the internal medicine doctors in the area who had access to the test to let us come in and test everybody. Thankfully,
and special thanks
to Stan Evans, Dr. Evans, man, we really appreciate you, because we could have been shut down for several days or an entire week. So Dr. Evans,
because
Stanley
these
Evans,
places. Because these places that are doing these testings are booked out for days and days and days.
It's absolutely insane. One other, I think we should continue to keep running down this.
So there's a myth that is spreading right now regarding these rapid testings. They state that rapid antigen testing does not work if you're asymptomatic. That's a myth.
It's a misunderstanding of what you're expecting out of the test. Absolutely.
You could be asymptomatic and still get tested positive, because if you have the virus in your system, that's what it's testing. It's not testing for the RNA factors that come off of the virus.
Right. The most recent Abbott Binax Now rapid test studies, the false positive rate has been less than 1 in 200. And in addition of the confirmatory rapid tests to each household's packet, this is talking about the potential packets, you could bring the specificity to greater than 99.9%. So that's, again, the rapid antigen test backed up with the PCR.
Yeah.
And you have a specificity of upwards of 99.9%. and higher if those confirmatory tests leverage the more specific but much more limited supply of the soon-to-be at-home PCR tests. I mean, the fact that we don't have this, the fact that this isn't more of an uproar. Dr. Mina has been talking about this since November.
Yeah.
And the title of his paper was, "We could have this cornered by Christmas." And that didn't happen. Why? Because we put all our eggs in the vaccine basket. We can't even distribute them because we don't have enough people to distribute them.
Yeah, they're saying that if we get more than 50% of the population vaccinated, herd immunity, we should be fine.
It's going to take a while.
Yeah, if we're not giving those shots out, we're not going to get that number.
It'll take forever. It's going to take months, which is absolutely insane. It's interesting. He talks about, leveraging some of the biggest companies on the planet, AT&T, Verizon, Apple, Google, Facebook, Amazon, to figure out the easiest one-click reporting tools that anyone can use. Because if we reported a fraction of the massive number of tests that people were taking, you'd ultimately have enough epidemiological information to have the epidemiologists like Dr. Mina be able to find where these outbreaks are happening, these little hotspots, and squash them. Yeah. That's how you kill a pandemic like this, is you find the outbreaks and you squash them. I'm not an epidemiologist, and I understand that. It makes perfect sense. Contact tracing works when you have data.
Yeah, we're solely relying on the hospitals and these primary care doctors as far as data sets go. But if we can report the data ourselves, test ourselves, simple following of restrictions, wear your mask, do your part in staying distance. You get exposed, you test yourself, you test positive. Even if 50% of the people who tested positive reported it, we would have such great numbers as far as data sets go to record this disaster we're going through.
So, once again, the FDA guidelines are squashing this. The need to separately qualify a rapid antigen test for symptomatic versus asymptomatic use, that's insane. Folks, we're in a global pandemic. FDA, pull your head out of your you-know-what. I mean, this is insane. You're slowing development and authorization because it's hard to find asymptomatic people when they're contagious because they think they're fine.
Yeah.
So when the antigen test is meant to be positive, so in order to gain an asymptomatic medical claim, you got to find these folks, and they're not easy to find because they're not the ones looking for care.
And it takes time for you to get your symptoms.
Right.
When you get exposed, they say it's between 4 to 7 days when you actually start showing symptoms. So you could easily be spreading this virus during those days that you don't have any symptoms, no fever, no cough, no congestion.
And that's where you're infecting potentially up to 130 other people.
Yeah.
Yeah. Requiring these rapid tests to be a public health tool that gets funneled through a medical diagnostic authorization process also runs the risk of diluting down the test metrics that medical diagnostics demand, which again are distinct from the public health issue. So, I mean, this seems to be a bureaucratic nightmare. I mean, the beauty of a bureaucracy and government is that they can mobilize and leverage massive amounts of dollars and people and move them in the direction of trying to squash something like this. And we have done a crappy job of leveraging all of the smart people we have, all of the dedicated healthcare workers that we have, and handcuffing them with ridiculous regulations like scope of practice issues for injecting people with a vaccination. This is insane. Kudos to Lex Fridman for having Dr. Mina on. Lex, probably never hear this, but maybe you will. I don't know. You're awesome. We really do appreciate all that you do. I think you're doing a fantastic job. You can tell that you're passionate about this, and hopefully that passion has come through with my reaction to this, because it's just insane that we're still talking about this. Dr. Mina's Time magazine piece in November should have been a massive illustration to our government on what we're doing wrong and what we could be doing better. And apparently that's not happened and still not happening. And it's not a Trump issue. It's not a Biden issue. It's a governmental issue. It's bipartisan problem. This is not a political statement in any means, any way, shape, or means, but they're both failing because I don't hear the Biden administration talking about their plan for getting rapid tests into the hands of every American.
Or vaccine.
Yeah, I mean, this is insane. I got vaccinated a week ago with the Moderna vaccine. I've got my second shot coming up on the 28th of January. I had a little soreness, no other symptoms. Anybody who says that the vaccination process is potentially an issue is just missing the boat. But again, I would be much more confident in having access to rapid tests and be able to test myself, test my family members, than just rely on the vaccine alone. Because again, we also have issues with the virus mutating, and we're going to need access to rapid antigen tests for potentially new spike proteins, for new antigens on.
It's like influenza.
Yeah.
Every year we get a new strain.
Right. But and if we had access to rapid tests, it's going to be much easier to produce those than vaccines that are specific for those new waves that we may encounter. So again, the antigen, the rapid antigen testing is how we fight this, and it's how we're going to continue to fight this. And it doesn't seem like we have any plan for getting this in the hands of Americans, and that's sad. And the crazy thing is that Slovakia has been doing it.
Yeah, the UK.
The UK and specifically Slovakia. Little Slovakia has used the rapid antigen tests in a perfect way, an epidemiologic way, and the epidemiologists are using them as an example of how you can do this and have it be effective. They are squashing the pandemic in Slovakia because they have access to rapid testing.
Yeah.
And we are the greatest nation in the world, and we're sitting on our hands.
We're literally living in history right now. World War II, we had 400,000 deaths. That was immense. And we're creeping up onto it right now. And that was a war. That was literally a war.
We're in a war. We're in a war with bureaucracy, and a virus happens to be involved. But right now, we're in a war with bureaucracy and insane federal regulations that are keeping a public health device out of our hands.
If people don't realize, COVID is the third leading cause of death in the U.S. right now. Compared to heart disease and cancer, it's number 3. We're not fighting something that's a minute, little problem right now. This is something that's taken out hundreds of thousands of people. I mean,
and destroying our economy. If we had rapid testing, we could see the economy bounce back. We wouldn't have to close. We wouldn't have to shut down like the UK just did. I mean, literally the United Kingdom just went into a lockdown again. Why? Because I'm sure they don't have access like they should for rapid testing either there as well. I mean, they started with the vaccinations faster than we did.
Yeah.
But again, if we had rapid testing at the levels that we need them, which is, 15 to 20 of them for every American, we'd be able to get a hold of this and be able to keep people from infecting our fellow Americans.
If they give out this rapid testing, you could theoretically say that they probably wouldn't have to give us another bonus, whatever that test that.
The $2,000 check, which I'm probably
not going to complain.
I'm not going to qualify for it, I'm sure. But at the same time, I would say take that $2,000, put it back in the pot. Let's start building some rapid tests.
Yeah,
I mean, this is insane. $2,000, I'm sure, is a lot to a lot of people, but it pales in comparison to what we could be generating, allowing people to go back to work, allowing people to prevent them from infecting family members who are at risk. It's so much more important.
They've shut down jobs, restaurants, all these places that, because people got so bad at, quarantining and doing their social distancings and whatnot. And the pandemic has just gone out of control. places have closed down, and we could easily open them back up if we could nip this in the bud.
If we had rapid testing. You could literally rapid test people on the way into the restaurant.
Yeah.
You could rapid test yourself waiting in line for your table.
Even if they didn't give it out to every household, if they give it to airports, public places,
right?
Costco, you're going to Costco and there's hundreds of people there. If they tested people at the door, that's easy way of preventing people from getting the spread.
Yep. And we still need to do the simple things. Yeah. You still need to wash your hands. You still need to use your masks.
Social distancing. Don't go to parties and raves.
Right. At this moment, that's still important. But theoretically, if you wanted to, Joe Rogan's talked about this. Joe's talked about this on his podcast. He's like, if we had access to rapid testing, you could rapid test everybody for the antigen, which means they have, not only they've been infected, but they have antigen in their system. You could rapid test, and if they were negative, you could let them go into the concert. And they could go watch Joe Rogan with 50,000 other people, and you wouldn't have a massive outbreak.
And that's the difference between this PCR testing and the rapid testing. The PCR testing, you have like a 4-day lag from when you actually get tested to when you actually find out the results. During those 4 days, you can easily get tested. You
could be Typhoid Mary.
Yeah.
You could be infecting everybody you know that you come in contact with. Yep.
Yeah, those political events that happened were the super spreader events. They did the PCR testing before those. Those were 4 days in between where they've been going around, shaking hands, kissing babies, and now they pick up the COVID, and now when they go to this event, spread like crazy. They could have stopped people at that door, tested them, gave them like 15, 20 minutes of wait time, which I'm sure is nothing. Walk in knowing that you are 100% negative with COVID.
Very, 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 very unlikely that you have COVID. That's all we're looking for. We're trying to play the percentages here. Go back to that, to your face mask.
This one.
Yeah, the type of fabric matters.
Yeah, so face masks, simple precaution. Most states have kind of set up a guideline or regulations to how to wear face masks, what face mask works, what are the recommendations. In the office here, we highly, highly, highly recommend people to wear the face masks. And 99.99% of people do.
We turn them away, honestly. If they're not willing to wear a mask, we don't see them. It's just gotten to that point.
And you can make your own masks. There's a lot of information online on the best types of masks. You don't have to get like N95, which are the ideal type of mask that you can wear. But you could get a t-shirt. There's those scarves that people are wearing, and there's different materials that have been shown to be more effective. Silk is great, but it's not as effective. You're not able to catch that virus before it leaves. I saw a lady that she was wearing one of those net type masks, like you can 100% see her face, and then she was wearing the mask under it. But that was because she got here and we had to put the mask on. Hey, look, this is obviously not working. Would you mind wearing this in conjunction? And most patients are understanding. But if you go to look at this slide on how the virus spreads, I know that people have said that the COVID virus size, whatever, is a certain number of microns. I don't know whatever it was, 0.2 microns, or I don't know whatever it was. And obviously your cloth isn't able to filter that. But when COVID spreads, it's mostly based on the droplets.
Right.
It's not the individual, micron that's flying out there. If you were able to catch 99 or 90% of whatever's coming out.
Of the droplets.
Yeah. We're using these in the hospitals, during surgeries. People use them when they're painting houses, when they're working in chemical plants. People are always wearing masks. There's no reason that the vast majority of people should not be wearing masks whenever we're talking about the lives that we're losing.
We don't want to be leading the world in daily deaths due to the pandemic, and we are. I love that one, the antivirus CD. I seriously hope that lady just thought that was funny. I'm not really sure. She may have really thought that was an antivirus, but that's fantastic. We don't want to joke about Corona, but man, we've been dealing with this for almost a year now. And if you can't keep your humor, we're all going to be in big trouble. But look at this. Speaking, We know this. This is stuff we know. Look, one layer cloth covering. Look what it does to the droplets.
It's a
Two-layer
shame.
cloth.
It's a shame that we're saying this like it's something new. We know that masks works. This is something that is globally evident. You know, whenever you have any type of procedure done, we know that you can spread the viruses, bacteria that are in your mouth. That's why we wear masks. That's why we will gown up, you know, top to bottom.
In the operating
ICUs,
room.
I mean,
Right.
always. But this is,
And look at the difference that a surgical mask makes. And so thankfully, a lot of our patients are wearing those when they come in the office, which is great. Yep, we appreciate that. You got your little cartoon of your spike proteins.
Yeah.
Like that.
Let's talk about the amputation rates compared to COVID.
So this is something that we saw, I think, anecdotally in the office. We were starting to see more diabetic patients who were coming in further down the line, infections, bone exposure. And so we were doing a significant number of amputations during the original lockdown. And it was evident that this was an unintended consequence of telling people to shelter at home. People weren't getting the routine care that they were typically getting. And so they were getting wounds that were getting infected. And we were losing an opportunity to intervene early on in that process because they were staying at home and they didn't want to come in and they were worried about COVID. And I think the unintended consequence was we saw amputation rates go up. And this was fascinating. This was published in November with the Journal of the American Podiatric Medical Association. And it literally confirmed what you and I were seeing in the office, which is scary and sad, but again, one of the unintended consequences of telling people they need to shelter at home.
Yeah, the stats don't lie. The odds of any level of amputation was 10.8 times higher during the pandemic versus before.
And probably not the pandemic, but specifically the lockdown period.
Yes.
Yeah. But now we got people that are diabetic patients that typically would come in for routine care every couple of months. People who have neuropathy, who have sensory loss, who have had a history of wounds. We get them in sooner. We see them routinely multiple times a year. They weren't coming in. We have people who didn't come in for diabetic shoes this year.
Yeah.
Period. They haven't come in. We're putting the word out. Hey, look, we got to change your shoes out. The diabetic shoe program through the Medicare program saves limbs and saves lives. And it is a great program that's continued to allow us to prevent wounds. And patients haven't been coming in to get their new shoes, again, because they're concerned about COVID.
People don't see their primary care doctors, don't see their podiatrists, don't see their vascular
doctors. Cardiologists. Yeah, I mean, it's not just podiatry what we're seeing.
It's everyone.
But the unintended consequence in our realm has been the amputation level has definitely gone up.
Yeah, and during this lockdown period, they saw that major amputations, we're talking about below knee or higher. So you're going to be using a peg leg. Yeah, you're wheelchair bound or you're using a prosthetic device. Was 12 times higher compared to before the pandemic. That is so bad.
Yep.
Imagine telling a patient that they're going to lose their limb, and it's not just like a toe or part of their foot, but you're literally going to be handicapped for the rest of your life.
And that was in patients in a foot and ankle service. So I mean, this was in a specific foot and ankle service where they are well trained in restorative orthopedics and traumatology. I mean, these were people who deal with the limb salvage aspect of what we do for a living, and that was still a problem. Odds ratio of 12.5. That's scary. And these folks, unfortunately, are now in a category where 60% of them may not be around within 5 years.
Yeah,
because of that amputation. The odds of receiving a major amputation was 3.1 times higher than before the pandemic. And that is scary.
Yeah, that's the difference between a toe or your limb. Mm-hmm. I mean, that's the difference when we talk to a patient who comes in initially, my foot is red hot swollen, I have a spot on my foot, versus someone who's been staying at home. They're like, oh, it'll get better. I don't want to get COVID. I'm not going to the doctor. I'm not going to the hospital.
I don't have a rapid test to test myself for COVID. FDA. You hear the crickets? So
they saw the same thing in other countries. It's not U.S. dependent. It was in Italy and in the Netherlands. I mean, they saw an increase in all of these amputations.
So again, we go back. I'm joking with the crickets with the FDA aspect of this, but if they had rapid testing in the hands of all of our diabetic patients, they could say, okay, don't have COVID. I'm going to go into a safe place where we keep all our patients out in their cars until their appointment time. We don't have the lobby full of people. The opportunity for you to catch COVID in our office is extremely low because we're social distancing. We're keeping people in their cars. If you could test before you came in and then test after you got back home or the next day or the day after, you could be assured that you didn't catch it and get the care that you need so that you don't end up with the amputation that's going to be life-threatening.
Yeah, most offices are doing some level of testing before they come in, but the testing they're doing is temperature-based. And
right. It's a screening, and it's not nearly as effective. Not nearly as effective because you're not going to capture the asymptomatic folks.
Or you're in that period where you don't even have symptoms, that 4 to 7 days.
Yes, you're catching it too early. Right.
Yeah.
Yeah. So I think this paper that was published back in November really highlighted something that we were already seeing, which again was very scary. So be like the Mandalorian, keep distance from others, avoid large groups, and never touch your face. This is the way.
This is the way.
Yeah. Big Mandalorian fans, we both are. I think if we all wore Beskar, we'd be all right. But I don't know if that's possible. Well, I mean, Dr. Hussain, I think we're doing the best we can. I think it's absurd that the Texas Department of Licensing and Registration is going to limit our ability to do injections. We could be doing vaccinations. So if our friends and family are hearing this, reach out to your, state association. It's different in every state, but the Texas Department of Licensing and Registration is responsible for that. And they could wave their magic wand and make that ridiculous bottleneck go away and
for
allow
all
it.
specialties.
For all specialties. Yeah. Not just us, but for all specialties. Understand that this is a global pandemic, that this is a public health emergency. We have people dying every day here in Texas and all over the United States. And we can't vaccinate enough people. I mean, clearly there aren't enough warm bodies capable of doing this. And that's absurd because they're here. We're here. We're reaching out. There are 16,000 of us in Texas that are all capable of doing vaccinations, all capable of doing them. And right now we can't. And it's absurd. So if there are two things you get out of this podcast, it's one, I'm ticked off, and I'm really angry with both the Trump administration and the Biden administration, both of them, because right now we're in the the lame duck aspect of the transition of power. But somebody needs to pull their head out and get us the rapid tests that we need, and to stop these ridiculous bureaucratic bottlenecks that are keeping Americans from access to rapid testing. Because clearly that's the way to establish where these breakouts are happening, where these hotspots are, and squash them.
Yeah,
let's be like Slovakia. I never thought I would say that. No offense to Slovakia, but good job, Slovakia.
Yeah, hats off.
Yeah, I'm telling you. Yeah, we salute you, Slovakia, because you guys are doing it right. Way to go. And you're leading the world. We need to be rapid testing everybody. So. We are 39 minutes into this, so I will get off my massive soapbox. And Dr. Hussain, thank you for putting together the slides. Again, I do want to shout out to Joe Rogan and Lex Fridman. Listen to their podcasts. They're fantastic. Lex, again, thank you for having Dr. Michael Mina on. And we are hoping to retweet as many clips and quotes from that podcast as possible, to just help get that out there in the universe, and hope that somebody important is listening to this, so that we can change this within the next few weeks, hopefully. So thanks again. We are the PODdoctors, and we will see you next time. We are
the PODdoctors.